So we've spoken to healthcare workers at the start of this pandemic. It's clear they face a very hectic task. How are those entering into the profession now feeling?
Well, Shahan, there are those that have gone home and there are those that are starting this year that are just early in. But the ones that have had to face the pandemic from the beginning, they are really exhausted. They say that they are traumatized and that they had to worry about simple things like PPE. There seems to be an issue as to whether or not the entity that you work on and the institution that you come from or the higher education, who's going to pay for the PPE for some of the nurses. So that alone has kind of put a strain on them, and at the same time they're saying that they're traumatized. The things that they have seen in the field is not exactly what they had thought about when they were studying, but it is something that they were ready for, but not exactly ready. So the pandemic has kind of taken its toll, and they're saying that they need assistance in terms of getting counseling. They're saying that the government itself needs to look into making sure that they get counseling. Another issue being a situation in terms of making sure that they have jobs after ComServe. A lot of them, doctors and community health workers, saying that they're not sure if they're going to get a job because most of the hospitals are now depending a lot on agents, and at the same time, some of them have had to stage a sit-in before they were able to get a job. Now, what happens to you when you have served so well under the COVID pandemic and you don't know whether you can be compensated if you take the vaccine or not? That's what basically are all those questions, and they're saying that these things have not basically been told, they have not been told about, and now they're just basically living in a bit of a confusion. But let's listen into what they had to say. The COVID-19 pandemic is taking a mental toll on young doctors and nurses.
You need counseling at some point for such an experience.
Everybody is struggling from burnout. Some are struggling from depression and anxiety.
And while they are praying for the horror to end, the Junior Doctors Association says they are also worried about their futures.
A lot of our members post-ComServe are either in short-term COVID contracts or short-term hospital contracts. These are 3-month contracts while the current posts have been frozen. Unfortunately, we've also lost some of our colleagues to international posts.
Nurses like this one, who works at Rahima Musa Mother and Child Hospital in Johannesburg, are just as concerned.
In the previous week, there was a sit-in at the Department of Health demanding absorption of community service professional nurses. There's also another issue of PPE, personal protective equipment, that is still not adequately, provided.
Gauteng Health MEC Nomathemba Mokgethi says they are addressing the employment concerns.
We also took out a circular to all the hospitals to say, if you have vacant budgeted positions, absorb them with immediate effect. And those that cannot be absorbed in the existing structure, we will be negotiating with them to put them on a contract.
These doctors and nurses continue to work tirelessly to fight COVID-19, even as their own futures are unclear. Nqobila Madladla, Johannesburg.